So hello everybody, thank you for your attention and spending part of your afternoon for this webinar. It's very interesting to see a lot of different solutions in the digital health space. And I'm going to present Kelvin, which is a project about shifting a bit the medical imaging from the hospitals and the laboratories to a home environment and how this can be achieved with consumer hardware. So just a little bit of background about Imagga. This is the company that I co-founded approximately 10 years ago, one of the pioneers in image recognition technologies in general. Now it's very fashionable to say to have artificial intelligence and machine learning in almost anything. And I'm happy that we were one of the pioneers, even before a very topic. More than 15 billion images for various use cases along the years. We trained some of the biggest image classifiers in the world, including hundreds of millions of images of hundreds of thousands of different plant species for PlantSnap. And due to various research, we are one of the best out-of-the-box generic tagging solutions. So this is the Imagga's background, but actually what we did about 2 months ago, it's a very new baby project, but progressing quite well, is that we formed a team of almost 20 people with backgrounds in different areas, including medical. And we proposed, not just proposed, but we started working actually on a solution for remote telemedicine and home-assisted diagnosis. It's not diagnostic tool or not intended to be such maybe in the short term, but it's something that improves. So it's a combination between medical science per se and by itself, but also the application of thermal cameras, this one that you can see here, and artificial intelligence that can analyze your condition based on basically the blood flow distribution, because the blood flow distribution itself has a direct impact on the temperature. So just to give you a glance here, you can see how different parts currently of my face have different body temperature. In a real world environment, I need to be at home and to be shirtless and take a photo of all my upper body from the abdomen up to the forehead. Obviously, I'm not going to do this right now. But the idea is that having this additional sensor, which is currently on a, let's say, not too affordable price, but still not too expensive. The consumer price of this is approximately 400 euros. And we are working in direction to use that, but using the home environment on a regular basis, you can perform some kind of analysis of your health condition that then can be escalated to the right medical professionals. And it has the ability of collecting a lot of data and applying this for the purpose of machine learning, especially in combination with the ability of the patients to provide additional feedback about their condition. So I briefly walked through the process already, but you take this other selfie or a third person is taking a photo of you, you submit it on a regular basis, then we analyze segmenting the thermal image, detecting various anomalies there, and perform some kind of preliminary analysis on what's your health condition. So this is applicable to various use cases ranging from respiratory diseases where you have direct impact because of the lungs and blood flow are very related. And you can see certain anomalies if you have respiratory infections, including the application of this tool for COVID-19 related respiratory infections. Also, any type of vascular related diseases, they have direct impact on temperature because of the difference in the blood flow. Something very interesting, especially for organs or body parts that are quite exposed on the body, like female breasts, for example, can be spotted certain type of anomalies there pretty early. And when you have fibrosis and still not having developed a cancer condition, but this can be cross-referenced, and we are currently doing very active research on that with computer tomography, and we can validate that fibrosis is very easily visible on thermal imaging. You can look at this from various aspects, from inflammation to thrombosis to different change of volume of the vascular system. The AI component itself is reading the thermal sensor info, and then it can analyze the overall distribution of the body, including finding anomalies and different types of asymmetrical behavior, which is not typically normal in a healthy person. And also it can identify specific spots on the body that make sense and make difference for the detection or the suggestion of potential condition in the body. Currently, the way the media, how this thing is delivered, is through a mobile application with the camera attached to it, where you can, as I said, take photos of yourself. You can distribute this information to our secure backend, and we can analyze this in combination with the traditional data that you provide, like demographic info, any other type of diseases you have. I won't spend too much time on the technical part for the camera, but I just want to mention that our aim is to decrease the price of this to under 130 euro. I'm exploring opportunities to do this with several manufacturers of thermal cameras worldwide, in considering even developing our own, so this can be more affordable and in more control of what kind of thermal signal we can read and how precise it is. Obviously, the pandemic use case, as some of the colleagues already mentioned, any type of analysis that can be related to either detection of outbreaks or detection of specific condition of an individual is very useful. And we believe that this, what Kelvin offers, can also be really useful in prevention of complications, potentially. Something that's very important is that your body temperature doesn't change immediately when you have an infection. It needs to progress severely for you to start to have a tangibly increased body temperature. But still, at the same time, because of the nature of what an infection is, you have a local response of the body and a local change in temperature. And this is what we can quite easily and straightforwardly detect using the thermal camera and the additional analysis that we do on the backend machine learning side. As I mentioned briefly before, there's a lot of cases, though. I think, as with most of our solutions, the COVID-19 pandemic is just the trigger for those to be unleashed and maybe regulated more properly and more openly in a way. But we see a lot of cases of this post-pandemic where you can detect or at least be alerted for various types of changes in your body. As I said, we don't aim at this stage to diagnose things, but as you can use other devices to have something that's spotted as anomaly in your condition, and then you can look for specific medical help, of course, without freaking out in the meantime. You have a way to be a few steps ahead of your condition. We believe this is very important for the healthcare system and the social system in each country, because if you can prevent a huge number of diseases that goes asymptomatic for a long period of time on the surface, but in the reality, in the universe of thermal imaging, they are quite visible. This has a huge impact both on the healthcare and even the economic power of a country and worldwide. So currently we did multiple things, and one of them was also cross-validating what can be achieved with X-ray images, and can we find some correlation between what's visible on the X-ray and the thermal images, and we see certain correlations. Of course, X-ray is a different type of imaging device, and the way it functions is not isomorphic with a thermal camera, for example. But we see that a lot of changes in the structure of the tissues have some kind of projection on the thermal image itself. We started building the actual machine learning purely for what's visible once taken with the right conditions and from the right perspective. We developed iOS application. Yep, thank you. I'm almost finishing. We developed an iOS application that can be accessed through TestFlight. If you go to our website, kelvin.health, you can request the iOS version, and eventually the Android version will also be available soon. So yeah, basically that's it. We're looking currently for ways to extend the trials of this, first for medical experimental purpose, then eventually go into a more formal clinical trial process, and looking for more people to join those tests on whatever basis, including crowdsourced to our application. That's it.
Thank you very much. We